Hello and what's up, beautiful people? It's your tooth doctor Maureen Mora here. If you are new to this channel, karibu sana. All we do is talk matters oral health, and it is simply because I believe everybody is entitled to good oral health status. This being our oral health week, I will want to urge those of you who may be having dental questions and you've not gotten time to visit your dentist and make inquiries about them. Feel free to drop the questions in the comment section. I will try my level best and give you the feedback. In today's video, I want us to talk about the common oral disease, and that is dental caries, commonly known as tooth decay or cavity. It is basically a bacterial infection when the hard part of the tooth, also known as the enamel, this part right here, it becomes whereby it becomes weakened, causing lesions or holes on your tooth. This wearing off can get advanced and get into the inner layers of the tooth. Tooth decay, being the common cause of dental pain, is a process that happens gradually over time, whereby one might not even notice they have the cavity until the tooth becomes symptomatic. The major causes of tooth decay is usually a process that occurs over time, and I'm going to try and explain to you in the simplest way how the process takes place. So, assuming you consume a diet that has a lot of sugars and starch, then you fail to clean your teeth. There are bacteria in your mouth. They are going to feed on that, multiply. Once they multiply, the outcome will be something that we usually call plaque. Plaque is that clear film that usually coats on your tooth. This plaque, once it stays there over time, it is going to produce an acid. This acid, in many circumstances, it is going to start now wearing off ama eroding the minerals on the hard part of the tooth, that is the enamel. Through this, tiny holes or openings begin to form on your tooth. If the bacteria and the acid finds way to the other layers of the tooth, then definitely they are going to cause destructions on the tooth, and the end result is going to be cavity, as you wanna call it, tooth decay. However, there are several risk factors that are likely to lead to tooth decay. Number one, we have the location of your tooth. For instance, the back teeth, which are the mostly known as the molars, are likely to be susceptible to getting dental caries, some tooth decay, as compared to the front teeth. Now, it's simply because most people have difficulties in brushing the back teeth, and that makes me to reconsider probably doing a video and give you a few tips on how you are likely to clean your back teeth. Also, we have the tooth morphology. By tooth morphology, I mean, if you look at my dummy, we have this back. Don't know whether my camera is doing some justice. If you compare the appearance of this back teeth and the front teeth, on the back teeth we have some depressions here, where if food packs there and you are not in a position to do proper cleaning, then it is going to attract bacteria. The process happens as I'd explained early, and the end results are going to be cavities. So another risk factor can be certain type of foods and drinks. For instance, we have milk, we have honey, we have candies, we have cake. If you look at this type of food, most of them are sticky. So once you consume them and you don't practice proper tooth cleaning, your teeth are likely to get some cavities. We also have inadequate brushing. That should be my number one, but I believe even in my other videos I have emphasized on that and I can't emphasize that any further. Proper cleaning is so crucial in controlling most of the dental problems. Another risk factor is bedtime infant feeding. And at this point, I'm looking at those babies who are usually bottle fed, and the components in the bottles are either the formula milk, some juice, or sugar containing liquids. Remember, if they drink and continue sleeping, these substances might be remaining in their teeth for the hours that they are going to sleep. And if that happens over time, the continual process is going to cause destruction because you feed the bacteria, the cleaning is not done, and then the decomposition is going to happen, and the end result is starting to notice cavities as at an earlier age, even as soon as the teeth starts erupting in the baby's mouth. We also have not getting enough fluoride. In my previous videos, I did talk about the effects of excess fluoride. However, not getting enough also has its own damages. So we have the required amount of fluoride that one is supposed to consume. Try and do that. But in our toothpaste, they have incorporated the fluoride, which if you brush like regularly, you are going to prevent your teeth from getting the cavities. Also, the effects of dry mouth. Dry mouth tends to attract a lot of bacteria. Remember, these bacteria are our biggest culprits when it comes to dental caries, tooth decay. Also, if you have worn out restorations in your mouth, kwa mfano you had a filling done, the filling fell off and you didn't go back to your dentist to have it refixed again, these failed restorations are going to make the tooth decay further because they create an environment where food is going to pack, the destruction is going to happen from there. Also, we have those people with acid reflux. Reflux is when you eat food and then there is that coming, the food tends to come out through your mouth again. This acid usually erodes the enamel component of the tooth. If this process happens over a long period of time, your tooth is going to start exposing, the holes are going to form. These tiny holes gradually progress to form bigger cavities. So guys, having said that, there are some symptoms I'm going to urge you to watch out, and this will be an indication that you could be having a tooth decay. These symptoms may vary depending with the extent of the cavity. For example, if you experience sensitivity from a particular tooth, majorly when consuming sweet, hot, or cold foods and drinks. If you experience some foul smell from a particular tooth. Also, when you try to floss your teeth, at that particular area, the floss comes out kama imeshred. That is also an indication that there could be a cavity on that area. Another sign to watch out as well is when you try to run your tongue through your teeth, you experience some roughness on the edges of your tooth. It could be an indication that you may be having a cavity. These are early signs, and it is the best time for you to visit your dentist, because if you don't do so, then we will be having the effects of untreated cavities, which may include pain for no apparent reason. Umekaa tu, meno ndio inaanza kuuma, unashangaa what is not happening. Also, you might be experiencing mild or sharp pains, especially when consuming hot or cold foods. Another effect of untreated cavity is dental abscess ama swelling. Unaamka asubuhi one day, one side of your jaw is swollen and previously you didn't have any issues. Another effect is if you have, for instance, a filling done and the tooth has started to decay, you don't seek for help at an earlier stage. the restoration that was done before is likely to fail, and maybe it will have to be adjusted or change of the current plan of the current treatment that is already on your tooth. Another effect of untreated cavity could lead to your tooth breaking. So maybe you are eating something, you realize, boom, there is something in your mouth. Just to look at it, you find it is a piece of your tooth. Another effect of untreated dental cavity at an earlier stage can be the cavity may spread to another tooth. So if you had one tooth that had minimal caries, you didn't seek for dental advice, the cavity might progress and affect the other tooth. For dental caries, the prevention is number one, watch out for those risk factors that I had mentioned earlier. Number two, try and practice good dental care. Number three, complement all that with routine dental checkups with your dentist. I hope you guys again have learned something today. If you find this message helpful, kindly feel free to share to your friends. Tell a friend to tell a friend. We need to form a good oral health squad right here on this channel. Till next time, bye you guys.